Yeah.
People just
Anyway,
won't
how's
stop
things
making.
going with you?
It's going pretty good, but we wanted to just ask you first off the bat, what are your thoughts on this issue of the nurses and the frontliners getting the short end of the COVID differential pay stick?
Well, I was watching your show and reading about the former Governor Calvo, what he said, and I think he's absolutely right. It doesn't. If it's in the book, that you're supposed to pay the frontliner double, then you should. To change that is kind of shortchanging the frontliners. If you're saying that, hey, they're important at the hospitals, especially, maybe you want to segregate that. Maybe the hospitals need to be double, and then you try to segregate it out. But I think the notion that, hey, we don't have enough money to fund that, I don't know. COVID-19 has given $117 million. I think that should be really allocated under healthcare. GMH only got in a portion of that, only $3.5 million. That's very small compared to $117 million. I don't know who got the bigger chunk of the allocation, but I think they need to revisit that and take a look. Because in the community side, we have the Health and Human Services. If you go on the website of Health and Human Services, if you're taking care of COVID-19 patients, you bill them directly, even if they're uninsured. If they're insured, you bill the insurance. So it's very simple to do, actually, and it dates way back since the end of, I think, in February it started already. So there's funding there. They just have to find it and appropriate in the right areas.
No, there's definitely funding. I saw there's breakdowns that indicated how the Trump administration, what kind of aid and grants that they provided to Guam. I don't have it in front of me, but it was a lot of money.
Yeah, and then if you're looking at the reopening of Guam, the two areas I think you really need to focus on is building capacity. And that's what the COVID-19 funding goes to. It's not the community clinics. It goes to hospital capacity. You have to focus on this COVID-19 and make a priority to dedicate the funding to the hospitals, to GMH, and if GRMC is helping out, they dedicate to GRMC. Even though they're private, you gotta focus on helping the two hospitals, because that's where, if you're gonna need help at, it's gonna be at the hospitalization side. The private clinic side, we have the PPP, the payment protection, like all the other rest of the small businesses, they can apply for that. And again, like I said, if you care for the COVID-19, you can also tap into the HHS funding, and that's very obvious, and that's pretty easy to do, actually.
Now, I understand that you wrote a letter on behalf of the Guam Medical Association.
Yeah, I did. In fact, I was chatting with Frank Campillo, and it's obvious that COBRA, I don't know if the community understands what COBRA is. For example, if you get laid off from your job, it's federal law that you have to provide COBRA coverage for your employees that get laid off or furloughed. But the payment has to come from the employee. So if you get laid off, obviously you're going to have a hard time trying to pay for the COBRA. But what's nice about the COBRA is that you pay the same rate as what your employer was paying for you when you were employed by the employer. So what the letter is saying is that because of this pandemic, they need to include Guam into the COBRA coverage for up to 6 to 9 months, I believe. And I think Marcus and Nicholas and Congressman Sablon, actually, office called me yesterday. We had a long chat, and I think they're going to work it in. And I think Marcus and Nicholas is going to work it into the House discussions, and I think Guam will be. I'm hoping that they include Guam into the bill that includes the COBRA coverage for our island.
Right.
But I think it's good. You know what the percentage is positive from Guam is? Do you guys know?
0? No.
Overall.
Okay.
It's pretty close to 0. We tested. Let me just give you an example.
I don't know, but we're thinking about starting a squares thing in the office, and I think 0 positives is the winning bet every day.
Well, I'm talking about overall percentage, right?
Yeah.
I'm not talking about just last week or two. I'm talking about overall. We tested nearly, I think, 4,000. Maybe we've gone past 4,000 by now. But the amount of positive we tested, I think, was 156. Let's just say 160, for example.
Okay.
Or even 170, I don't know. The amount of positive we have is less than 0.05%. That, I think, might be the lowest in the entire country, if I'm wrong. But that's very low. I mean, the nationally is higher, much higher than that. So I think Guam is doing good, and I think I want to thank the people, thank the media for helping us, taking out these PSA ads to stay home, and I think they listened. And you got to remember, Guam is flat. We're not New York City, Korea, or even Japan, where they have towering, condos that fits 5,000 residents in one condo. But I think we're doing well, and I think we're okay to start opening up. What I'm working on right now, and I've been busy this past week, is that I've recently diagnosed 3 patients with cancer, and they're very young. So I'm trying to get them off island for treatment because we don't have a gynecologic oncologist on Guam. We have one going to rotate through later on this year, but it's very difficult because we have to work on this, and I think the governor also needs to work on this as well, is that it's time to look at those patients that need to go off island for care, medical care, I mean. Cancer is not something you take lightly, and once you diagnose it, you want to try to get that patient out and treat it as soon as possible because we don't have the specialists here on Guam. So that's what I'm working on this past week.
What else you want to? Anything else you want to add in here, Doc? Because we haven't talked to you in a little bit.
Yeah.
I know you've been busy.
Get out and exercise. It's okay. I'm not breathing hard because I'm walking up a hill. It's so hard to wear a mask when you exercise. So I don't think you need to wear a mask when you're exercising, as long as, like right now, I'm standing in the middle of a park and there's nobody here. So I think it's okay.
Well, I saw you got a haircut.
I did. Oh my God. I did. In fact, I went to the barbershop. I called her and I said, hey, listen. And I go into a hole in the wall barbershop. I don't go to a salon, right? So I call her and I said, hey, listen, I'm going to wait outside. You call me in when you're ready, okay? And then she snuck her head out and said, I'm ready. So I snuck in there, got my 10-minute buzz cut, and I got out of there. So I feel so good. Oh, my God, 2 months of hair in my head. I'm like, God. And then, I guess I should be thankful that I still have hair. A lot of my doctor friends are going bald, and here I am complaining about too much hair. So
it's a good problem to have, Doc.
It's a good problem to have,
yeah.
And I'm glad that I got a haircut. Gave her a big tip.
Nice.
She was very thankful, so I think that was good. But one thing I have to say though, I think the message out there is, people are getting money, the stimulus check, which is very good. But one thing I have to emphasize, when I was growing up in Taiwan, is that my grandmother always say, hey, rainy day, you got to save that money. So if you get these checks, I know some of the bankers saying, hey, get out and spend. Well, hold on. I think you should save that, okay? Use it for essential items. Don't go out and just buy anything you want and just spend. I know the economy need a fuel injection, but you got to think about your families and think of the times when you don't have money and you don't have the $100 to go buy your kids food and cereal and things like that. So save the money when you get the stimulus check. Use it for only essential items. Don't listen to the banks and just say, go out and spend. That's not how you do it. Save the money for a rainy day. And there's going to be more rainy days to come. I can guarantee you that.
Hey, Doc, I wanted to get your thoughts because you talked about exercising. And what do you think about the gyms? Now, we haven't really got a lot of clear info on what the deal is. The gyms aren't allowed to open right now.
I think the gym is okay to open. And the gym is going to have to adapt to the new gym sort of atmosphere. You can't have gym crowded anymore. If you got a capacity of 100, maybe start off with maybe 20, 25, and then work it up from there. But each area is going to be designated. If you're going in as a couple, as a family, then you're entitled to your area. But rope it off, rope it off. Be creative with it. And once that session is done, make sure you wipe it off with sanitizers. And I think it's okay because, man, I don't know, I think I'm gaining weight. So I need to get back to the gym as well. But we do what we can, but you got to stay healthy because 6 months from now, if the population gets other diseases, that's going to be worse for us. So we have to ensure that our gyms get up to par, and I think they can do it. They just have to watch themselves, And theaters, theaters is a tough one, but if you can have a capacity of 200 in the theater, hey, if you want to open up for 20 people and block off one person per every 10 seats, that might be still okay. If you really think about it, right? Is there a limit as far as airline goes right now? Sure, I think they're trying to block off some seats, but still yet, when they say you can't have more than 10 people congregating, when you're in an airplane, you got more than 10 people no matter what. Yeah. So it's tough. But the more important thing is I think the governor's office needs to work on right now is how do we take care of the medical emergencies, cancer patients, those patients who need to get off island, and we don't have those treatments on Guam. That has to be emphasized. And I've been working on that this past week. That's why I think Philippine Airlines is going to start flying soon. And I think they have a strict quarantine that came out and released today. You may want to look at that. When you arrive at Philippine Airport, they test you right away. and you go into a quarantine facility until that test is positive or negative. If you're positive, you stay in the quarantine. If you're negative, I think they'll let you out.
Mm-hmm.
But if you're going to the Philippines for medical care, for example, cancer treatment, things like that, heart disease, if you go there, I'm working it out right now that if I have an accepting facility, accepting physician, they'll take you straight from the airport directly to the hospital, and you stay there. Even in Hawaii, it's the same way. Mm-hmm. I've gotten an exemption from Hawaii, the state, that I'm sending 2 patients with cancer, and they will exempt them. They will exempt them from quarantine. They'll go to the hotel. They go to the doctor. They go to the hospital. They can go and get food. You need that as essential. So things are being worked out, but I think from the governor's office side, I hope they've been looking at that, because I've been working at that for the last week and a half, because we have patients who need to get off.
There's also one thing that you've mentioned in the past, and it was about, testing at the airport. And then we hear I think it was over the weekend, that there was a passenger that was able to get to Saipan, and then he tested positive for COVID-19 at the airport.
That's a good way to reduce our COVID positives, is let them go to Saipan. Is that the strategy? I was wondering.
Oh, Chris,
was there an executive order?
And I guess you don't count them to the total here, but you count them over there in Saipan.
In the old days, back in Hawaii, they sent people to one of the islands there for leprosy and stuff, right? We don't do that anymore. Yeah. But you're thinking out of the box. But today's, I don't think that's going to pass. But I think testing at the airport is important. That's what I've been focused on. I say, are you going to keep quarantining all these people that are coming off? I mean, you're never going to be able to open the island. Yeah. You never will. And the Guam Business Bureau and the entire industry for the Tumon side, you might as well just cancel the entire area and turn it into all condos. Make all the hotel into condos and make that hotels into affordable housing. That would be a good one for Guam. If they're not going to open the airport and start letting tourists in, continue to quarantine people, test at the airport. As they come down, test them. And if they're positive, yeah, sure, you got to quarantine them. But I think the residents, when they come back, I don't think they should be quarantining at the hotel.
Right, and the Governor's Physicians Advisory Group, that was one of the things that was supposed to be discussed last night, was they were going to recommend that residents returning from anywhere in the mainland U.S. or in the CNMI, instead of mandatory quarantine, that they go on home quarantine.
I've been recommending that for weeks, because you can just make sure that they have a cell phone and you call in, just like jury duty. You got to call in once a day, let them know, hey, what's going on, and let your presence felt. But I think the residents on Guam are, right now, they're flying back. I think they're well educated. They're very careful. That's, at least the patients that I've talked to are those who are flying back. But I think you cannot continue to quarantine for that long. Even in Hawaii has a quarantine procedure that's in place. But their tourism industry is dead, and they're going to be heading to a recession if they don't do something about it. And they know that. The stimulus money that's coming in, the trillions of dollars, God, I'm really concerned and worried about that, because where are we getting all this money all of a sudden, Something's got to give. Either we're going to be in huge debt to the foreign countries, like China, for example.
Yep.
I'm telling you, China is going to own the world. They probably do already. But United States is going to owe China in all kinds of stuff, in trade and everything, because the more money we print out for the community, which is a good thing, but I think it's writing checks that we can't really cash in the long run.
Right.
So
I think there's an old saying: you're writing a check with your mouth that your tail can't cash. Doug, I wanted to ask you, because I know that you've been critical of, fairly critical of the administration. So we had, obviously, I know you said you saw the interview with former Governor Eddie yesterday. But what did you make of the response from Adeloop's policy director?
I didn't hear the.
Let me tell you the response. His response when asked by media to give a response to the Governor Calvo interview. Quote, "I stopped listening to Eddie Calvo interviews in 2018, end quote.
Oh, that's kind of insulting, in my opinion. I think all the governors, regardless of their history, even Governor Gutierrez, I think if I was governor right now, I'd call all of them in, the last 5 governors. I say, hey, listen, I need your help.
Exactly.
Tell me how to help this entire island, because 5 governors is better than one single governor, in my opinion, because there's history and they've experienced disasters. Bring them all in, sit on one table, and let's
God,
Let's
what a sight that
We're
would be.
in this together.
Can you imagine if
right.
the sight of that, and if they open a press conference and like, ladies and gentlemen, the governor of Guam, and then you see the governor with the other governors, like, hallelujah.
Hey, you got 5 governors sitting at one table. Oh my God. Hey,
6 feet
maybe I'll
apart.
stop criticizing by then.
We said this, I don't know, last month, how many weeks ago?
You said it last year.
Jeez.
Yeah, but I don't know. Maybe Eddie Calvo is going to run again. Maybe he'll be the first elected third-term governor. I think he qualifies now since he sat out a term. So you never know. He's making himself vocal. So the Republican side don't really have a candidate, I think, up.
Right.
So
Yeah.
maybe they're starting to talk and chat. And I don't know what former Governor Calvo is doing right now, but I'm sure he's enjoying his life. But I don't think he can
He's
stand
farming.
aside.
Farming, yeah.
I don't
Gardening.
think he can stand aside and watch his island, in the state that it is. But I think we're going to get better. But I think asking for help is not an insult. I think we have to put all our egos aside.
Yeah.
And people can say, I criticize, but really think about it. My criticism is constructive criticism.
Mm-hmm.
It's how to make the island better. It's not to criticize somebody to put them down or anything like that. It's to make things better. I don't have any financial interest in this entire game.
But I
just
think
wanna be sure.
that response, Doc, I stopped listening to Eddie Calvo interviews in in 2018. It kind of really shows that the pettiness of the administration, and it also shows that maybe that's why they don't invite Republicans to anything. And it is what it is, to quote a phrase. It's party politics. But I would just say to Carlo, maybe you should listen to this interview and take some notes, because the guy was governor for 8 years.
Yeah, that's not chump change. 8 years is I think.
I wonder what he does though when he hears Governor Eddie. Does he like just close his ears? No.
I don't know.
I stopped listening to that.
Mute.
It's like,
That's what
they mute.
Well,
Yeah.
Yeah,
Good one.
I think the governor is reaching out. I think he's reaching out. So it's okay. Go in. You can't shake his hand right now, but give him a mask and bring him into the room. Bring Governor
Zoom.
Harris and.
So how do you find time to be that petty in the middle of this pandemic? I mean, it's crazy.
Yeah, I think it's good. Bring all the governors together and then, put all the differences in politics aside and then focus on what needs to be done. I think that's what we call togetherness. If you can put all the politics aside, bring everybody together in one room. Yeah. But again, transparency again is very important. And the AG's got a headache right now.
Oh man. Okay, let me tell you guys. I tried to get the Attorney General on the show this morning, obviously because Governor Calvo called him out. People want to hear from the guy, and the response I got. Let me just pop this up for you, Doc. And I feel like it's very reasonable for us to request to have the AG call in. I mean, it's kind of normal.
Sure.
But the response I got was, can we get AG to call in tomorrow at 8:30 to discuss procurement, contracts, double pay, etc.? And then the AG spokesperson, Carlina Chafaris, writes, we can schedule something after we issue our opinion and request from the senator. And then I put, so not tomorrow. She said, we're still working on our response. We have not issued an opinion yet. We have yet to review a contract as to form and legality on any COVID contracts.
Any MOUs?
Right. It's tough to discuss things that we haven't seen completed or reviewed. So.
Yeah, you want him to talk about the procurement process. Well, that's important because you want a timeline. When was that procurement process, the date of the first discussion of that offer or any kind of MOU was discussed? That's very important. Timeline of events are very important. When it started, transparency. But I kind of wanted to hear him on the criminal side. I'm more concerned about that because 2-3 weeks ago they're letting people go. They can't prosecute. They're going to put them in jail. What I want to hear from the Attorney General's office is 2 things. One, I got no response to my letter. Remember the letter I wrote about the counterfeit and fake products that we should order? I haven't got that response. I think it's been 2-3 weeks.
Wow.
If you have a list of that, please let the public know so we don't order. You cannot fault the public from ordering products that we don't know that it's counterfeit. So if the government has already said we're going to confiscate counterfeit, then you must have a list somewhere. Show the list to us, publish it in the media so that we all know, protect the consumers. That's what I want to hear, number one. Number two, from the AG's office, how are we handling the criminal cases? Because we need to focus on that. How are we doing that? If the medical side, if our healthcare providers can help with that side, then certainly tap into us. We will do our best to help. But those are the 2 things that I I particularly was, wanted to hear. But yours is important too on the procurement side, though, Chris.
I mean, I think the point is we just want to hear from the guy.
Well, yeah, I mean, that'd be good too, right?
I mean, that's all I'm saying. You're a big boy. You're elected attorney general. I mean, why is it such a big deal for you to call a talk show? I don't understand.
Yeah, and I think BJ Cruz did call in one time, right?
Yeah, he did. Yeah.
Yeah, I know. I text the guy too. I said, "Hey."
I mean, I gotta say, no, Democrat, Republican, whatever. Objectively speaking, I totally agree with Governor Calvo's call out. I mean, it was classic, and he only said what a lot of people are thinking.
Yeah.
We stand here and we report on this stuff, and it's silence from the AG, it's silence from the public auditor. It's crazy.
And you know what's good about Governor Calvo right now is that he's out in the community. So he's actually feeling the private sector side. So that is a valuable experience for him because now he's feeling the pandemic from the private sector side. So I think that is a very valuable lesson that we can learn from him. So hopefully he speaks more. If we can't hear from other people, then we can listen to him. But, if you ask me which senators are Democrat, which senators are Republican, Chris, I have no idea. I really don't. Seriously. I have to really look at, okay, this is a Republican senator, that's a Democratic senator. I really don't focus on that when it comes to voting. When I vote for somebody, I look at the track history. I look at the bills that passed, and I look at if there's any conflict of interest. Those are the things that I look at when I vote. So, it's election season for senators, so we'll have to see what happens, John.
Oh, yeah.
There was speaking of the legislature, there was a public hearing that was held, I believe it was yesterday, regarding health insurance and choice.
How are they holding the public? Is it with Zoom that we can zoom in?
Yeah, it's through Zoom, virtual public hearings now.
Ah, okay. Well, I missed that one.
I'll send you the link.
Yeah, okay.
Okay.
I missed that one. And then I guess they'll call you when they see you on the link or something, I guess, right?
Yeah, it's pretty incredible because you see all these people up on the screen.
Now, the only I don't what did they discuss yesterday? I think it was a bill.
It was a choice of insurance.
Oh yeah, okay, yeah. That I do support. I think giving patients choice in insurance is a good thing, and I think Aetna, I think they're coming around, but it's still sometimes it's difficult to contact them because they're really off island. Netcare is local. They're doing a good job with their plan. So, I think expanding health insurance, and I don't know, I think the bill says we're going to expand it to only 2 choices, correct? If that's the same bill. Yeah. My recommendation is, why limit it to 2? Why not open it to all the insurances so they can compete and let the people choose? If one plan is more expensive than the other, then if you're if you're working for GovGuam, if you don't want an expensive plan, then you choose a cheaper plan, So, work it out and see. But I don't know if going with one is saving them much more money. But certainly, I think it's something that.
Yeah, I mean, the more the merrier, Doc. Totally agree. I mean, it should be Aetna, Netcare, Select Care. There should be an option in there to Surahanu.
Sure. I mean, even for doctors, I think giving choices to see whoever doctors you want.
Right,
yeah. I think that's good too. You don't want to limit. You don't. The bill that say, hey, I want you only to go see Dr. Shieh. And, I said, whoa, that's not good. I will protest against that because I don't want anybody to come and see me, and only me. I want the bill to say you can go see anybody else you want. It's your choice. Right. And I think if you give the patient the choice, the autonomy for the patient, the health care will be much better because they will say, hey, I chose you, and this is the relationship that we have, and we're going to work together, and we're going to improve my health. And if I can pick you up cancer early and we'll get you treated. There's a relationship. There's a doctor and patient relationship that's so strong that it's not by the books. That relationship is built upon trust. So you got to have that trust. But choice is good.
All right, Doc. Thank you so much.
Thanks,
all right,
Doc.
It was supposed to be 15 minutes. I think it took 20 minutes.
I get carried away.
We always like talking with you.
Okay, we'll talk later. Okay.
All right.
Doc.
Take care.
All right. Sure. Bye bye.
There you go, Dr. Tom Shieh. 7:12. We'll take a little break and come back with Tomas Maglotnia with CNMI. A little chit chat.
I thought we talked to him.
We did, but he's got some stuff he wants to
okay.
share that he's working on for today. 7:12. Good morning, Guam.